Hi there, my name is Dr. Matthew Cooper. I am a Canadian-trained physician who's worked both in Canada and Australia. I am trained as an emergency room physician, a chronic pain physician, and have been a cannabis prescriber for over 5 years now. Today I'd like to talk to you about the utility of cannabis in treating chronic pain, specifically for a number of chronic pain diagnoses, such as fibromyalgia, chronic pain syndrome, postherpetic neuralgia, and neuraxial lesions presenting with radicular symptoms like sciatica. In my experience, I have found cannabis to be an adjunct to conventional therapy or an alternative to typical and atypical prescription medications for chronic pain, such as gabapentinoids, tricyclics, anti-inflammatories, and opioids. I've been prescribing cannabis for chronic pain with some good results, and I'd like to sort of give you a primer on how to prescribe cannabis for individuals that might benefit from it. First of all, exclusionary criteria for prescribing cannabis. There are a number of disease entities and conditions that it would not be appropriate to prescribe cannabis. A personal history of schizophrenia would be a contraindication. A tachyarrhythmia, so a history of atrial fibrillation, SVT, or very recent cardiac event, which would make them sort of unstable in a cardiac, their cardiac condition unstable. Also, end-stage liver disease, pregnancy, or breastfeeding would be conditions which I would be very reluctant to prescribe. Most patients require very little cannabis to treat their chronic pain. When choosing a strain, I would opt for a CBD dominant oil. So that is a specific cannabis strain that has a high concentration of cannabidiol and or CBD and a low concentration of THC. This would result in treatment of their pain, but not any recreational effects. So no euphoria, no issues with cognitive changes or sedation, which are really important things when treating an individual for chronic pain. For prescribing, most individuals, when we write the prescription, I have an example of a medical document which we use here, would require you to put the patient demographics, the prescriber demographics, the daily dose, so most patients would be 1 gram a day, and the duration. Usually my first prescription would be for 3 months. I also like to put a THC limit, so I would put, in this instance, a 5% THC limit. What this means is your patient will never be able to order or inadvertently be given a higher THC strain. This is important because it means that they will have no effects from higher concentration THC strains. It's important with the dosing to emphasize to the patients a start low and go slow approach. This way it can capture the optimal control of their pain at the lowest dosage. For cannabis, in milligram amounts, we typically would start at 5 milligrams of CBD, and we typically do this as twice a day dosing. So you would start with 5 milligrams twice a day for between 5 to 7 days, and then you would elevate that up to 10 milligrams for another 5 days, and twice a day, and then 15, and then 20. So when we look at that in the milliliters, so dosing an oil is typically titrated in milliliters. The concentration is usually 20 milligrams per mil. So in this instance, you would start at 0.25 milliliters or 5 milligrams of CBD. and that makes dosing pretty straightforward for individuals, and they can do this with education by themselves at home. It's very important when prescribing cannabis to identify two items. One is international travel. So cannabis is legal for medical prescribing in Canada and in Australia, but traveling outside of those borders is strongly not advised. So we usually get patients to sign a waiver so that they will not travel overseas with cannabis. The second issue is with respect to driving. In prescribing cannabis, it is theoretically possible that an individual could be impaired. Now, having said that, a CBD dominant strain is unlikely, but still possible to cause impairment. There will be no cognitive impairment with a CBD dominant strain. We usually advise patients not to drive for 4 to 6 hour window after consumption of a cannabis oil. In terms of follow-up care, I usually see patients at a 2 to 3 month interval initially. It's important in the first time period to establish the optimal dose to control their pain. And also find the correct strain selection, which in most people would be a CBD dominant oil. If there seems to be very little response and there are individuals who are non-responders to a CBD dominant strain, it may be advisable to find a strain with a small amount of THC in that to help augment the effect of the CBD. Hopefully you found this video informative and helpful, and will encourage you to be a prescriber of cannabis CBD dominant oil for individuals with pain diagnoses.